Chapter 17, Segment 1 begins by discussing learning and memory. Learning is defined as the process of acquiring new and relatively enduring information, behavior, patterns, or abilities characterized by modifications of behavior as a result of practice, study, or experience. Memory then is defined as 1. The ability to retain information based on the mental process of learning or encoding, retention across an interval of time, and retrieval or reactivation of the memory. Or 2. The specific information that is stored in the brain. The next section discusses functional perspectives on learning and memory. Memory fails in many different ways, and through these different ways of learning through these different ways the memory fails, we have discovered that there's different forms of learning and memory, and multiple brain regions are involved in each of them. There are several kinds of learning and memory. We can't be sure that learning has occurred unless there's a memory that can be elicited later. The next section is titled, For Patient HM, the Present Vanished into Oblivion. Amnesia is defined as severe impairment of memory, usually as a result of accident or disease. Retrograde amnesia is the difficulty in retrieving memories formed before the onset of amnesia. After the accident, trouble remembering events prior to an accident, usually hours to years. Patient HM is a person who, because of damage to the medial temporal lobe structures, wasn't able to encode new declarative memories. Upon his death, he learned his name was Henry Malazan. He has okay short memory, but no long-term memory. His short-term and long-term memory differed. He had a memory deficit that was due to the loss of the medial temporal lobe, including hippocampus. He had improved tracing skills over days, yet he didn't remember doing the task. Brain damage like this usually produces difficulty reproducing, recognizing pictures and spatial designs, but they can learn some different kinds of information about verbal brain material. This led to a distinction between declarative memory and non-declarative memory. Anterograde amnesia is the inability to form new memories beginning with the onset of a disorder. Overall, from patient HM, they found that there's two different types of memory. There's declarative memory, which is memory that can be stated or described, including facts, information acquired about learning. Overall, we are aware of accessing this memory, and we have to use this to answer the questions about life. This was severely damaged in Henry. Non-declarative memory is procedural memory, where a memory is shown by performing rather than conscious recollection. This includes mirror tracing, riding a bike, and learning by doing. Medial temporal lobe structures are crucial for declarative memory. Delayed non-matching to sample task is a test in which, on each child, the participant must select the stimulus that they have not seen previously. This is the test of object recognition memory. Monkeys must identify which of the two objects was not seen previously. This declares that it remembers the object by reaching for the other object, the one that was previously not associated with the word. With medial lobe damage, they're bad at this and they have long delays. So by removing the amygdala, it's not crucial for the performance on tests of declarative memory, but the removal of the hippocampus showed impaired performance on declarative memory. There was more pronounced when this removal of the hippocampus and the impaired performance of declarative memory was even more pronounced when the entorhinal and parohippocampal cortex lesions were paired, and it was even worse when the pararhinal cortex lesions were added. The modern formulation of declarative memory has two processes, the first being the recollection of the item in the specific context it was presented in, which involves the hippocampus, and the familiarity with the features of the recalled item, being controlled by the pararhinal cortex. Contextual aspect of memory is controlled by the parahippocampal cortex. Overall, the hippocampus is the final stage of convergence of adjacent regions of the cortex that result in storage of declarative memories within the cortex. Because of this, hippocampal damage leads to difficulties with recollection and familiarity-based aspects of memory, while familiarity-based aspects of memory are spared. While perirhinal cortex damage impairs familiarity while preserving recollection. The next section is titled Damage to the Medial Diencephalon Can Cause Amnesia. Patient NA is a person who is unable to encode new declarative memories because of damage to the dorsal thalamus and the mammillary bodies. This causes anterograde amnesia, but it is mostly verbal. The damage to the diencephalon has connections to the hippocampus, being the dorsal medial thalamus, both mammillary bodies, and the mammathalamic tract. Normal short-term memory is impaired in forming declarative long-term memory. Medial temporal region and the midline diencephalic region are parts of a larger memory system. Damage to the fornix, which connects the hippocampus and mammillary bodies, causes selective difficulty in forming new declarative memories. Korsakoff syndrome is a memory disorder related to thiamine deficiency that is generally associated with chronic alcoholism, which leads to anterograde amnesia for declarative memories. Patients with Korsakoff syndromes tend to confabulate, which is filling in the gaps in memory with falsification. By admitting this, essentially makes them not admit that there's something wrong with them, and they fill in the gaps of memory so as to not admit that they have some sort of mental disorder. Temporal lobe structures are usually normal within Korsakoff syndrome, but they have shrunken mammillary bodies and damage to the dorsal medial thalamus. Because of this, mammillary bodies are key in processing the system connecting the medial temporal lobes to the thalamus via the mammathalamic tract, from there to cortical sites. Damage to basal frontal cortex leads to the denial and the confabulation. The main cause of Korsakoff syndrome is the lack of vitamin thiamine, or B1, which is usually low in an alcohol-based diet. In order to treat this, you usually treat with thiamine to prevent further deterioration, but you can't fix the damage done. Brain circuit with the hippocampus, mammillary bodies, dorsomedial thalamus is needed to form new declarative memories. Established declarative memories are not stored in these structures, though. Usually the cortex is optimized for this information storage. The next section is titled The Cortex is Essential for Long-Term Storage of Memories. Patient KC is a person who sustained damage to the cortex that rendered him unable to form and retrieve new episodic memories, especially autobiographical memories. Upon his death, we learned that his name was Kent Kosham. He was unable to retrieve any personal memories from his past, yet his general knowledge remained good. Overall, he couldn't obtain new episodic memories. This led to the distinction between episodic memories and semantic memories, episodic being memory of a particular incident or a particular time and place, while semantic memories are generalized memories, for instance, knowing the memory of a word without knowing where or when you learned that word. Extensive damage to the cerebral cortex and shrinkage of the hippocampus and parahippocampal cortex is what caused the inability to obtain new episodic memory in patient KC. Bilateral hippocampal damage leads to anterograde declarative amnesia, and frontal and parietal cortex damage leads to the inability to recall autobiographical details of life. People who do have incredible autobiographical memories have larger temporal lobes and an extremely larger parahippocampal gyrus. The next section is titled Different Forms of Non-Declarative Memory Involve Different Brain Regions. There are two types of declarative memories, as mentioned earlier, being semantic and episodic, but there are several forms of non-declarative memories. Their specific functions depend on different forms of non-declarative memories. Non-declarative memories shape abilities and responses to the world around us in ways that are difficult to express. Skill learning, a skill memory is formed by skill learning, which is learning to perform a task that requires motor coordination. This involves participants learn how to perform a challenging skill by practicing over and over again. For example, riding a bike. This mostly involves sensory motor skills, such as mirror tracing, perceptual skills, such as learning how to read mirror reverse text, and cognitive skills, such as puzzles. All three of these are impaired in people with damage to basal ganglia and also the motor cortex and cerebellum. This suggests that there's activation shifts of performance changes during the course of learning. Priming them is the phenomenon by which exposure to a stimulus facilitates subsequent responses to the same or similar to stimulus. This doesn't require declarative memory of the stimuli, and therefore it is not impaired by damage to the basal ganglia. Perceptual priming leads to reduced activity in the bilateral occipitotemporal cortex because priming makes the task easier. Conceptual priming then leads to the reduced activation of the left frontal cortex. This left frontal cortex is associated with declarative memory, and this provides evidence that components of the medial temporal lobe memory system are involved in some forms of non-declarative memory. And that is Chapter 17, Segment 1.